Hi, my name is Cliff Williman and I'm from Children's Healthcare of Atlanta. On behalf of my co-authors, I would like to present a brief highlight of our manuscript that was recently published in AJSM titled Transosseous Root Repair in Pediatric Patients Results in Durable Midterm Outcomes and High Rates of Return to Sport. In our series, we described 21 patients with a mean age of 15.6 years. There are 14 lateral meniscus root tears and 6 medial meniscus root tears. 85% of the patients had an associated ligament tear, with 12 ACL tears and 5 PCL tears. There were 2 root tears, though, that occurred in isolation, and both were tears of the posterior root of the medial meniscus. The majority of the root tears were avulsion types or prod type 5s. The mean follow-up in the study was 42 months, with one of the patients undergoing a secondary surgery 4 years after their initial root repair, with surgery to the same meniscus for a new injury. The median patient satisfaction was 10, and 81% of the patients returned to the same level of sport or higher. Meniscus root tears we found in pediatric patients most commonly occur as root avulsions of the posterior root of the lateral meniscus in association with an ACL tear, which is very distinctly different from that as we've seen in adults, which are typically tears of the posterior root of the medial meniscus that occur in isolation and are often a radial tear type pattern adjacent to the root. So in our pediatric case series, transosseous root repair resulted in successful outcomes in the majority of patients and high levels of return to sport. Thank you for your interest and for reading this manuscript.